Welcome to Redbeard Radio. I'm Brian Keith, and today we're talking about burnout, how to avoid it, and how to balance your passions with your obligations. We have someone who you've probably never heard of this kind of person before talking to you about this. We have Sabrina Runbeck. What's your full title? I can't even say the whole thing.
Yeah, I am a cardiothoracic physician associate. I am a public health practitioner and a peak performance keynote speaker and advisor.
Now, Sabrina, what does a cardiothoracic physician's assistant know about people who are pushing themselves to the limits of their performance?
Such a great question. We will always know CT surgery is one of the highest demanding subspecialty along with neurosurgery. Mm-hmm. There are such a high turnout in our field because the extensive hours we deal with, emergency calls. We all know heart disease is the number one killer in the world. And therefore, when you go to certain type of high functioning hospital, bigger teams, patients fly in internationally to see you, you're always on, you're always going. And so when I was a little busy bee and the typical one who just gone through my 2 bachelors, 2 masters, got into medicine. And I just felt like, yeah, this is exactly what I want. I would love surgery, love hands-on work, and really changing people's life, right? Like when they got to us for surgery, there's no other option. And that type of mentality also is what causes a lot of us in high-performing environments and careers to get so overwhelmed and feel like it's okay to be overwhelmed. And we also know by statistics, most people don't even want to talk about it. And because they thought it's just a sign of weakness. And then they go into using alcohol or drugs or even suicidal ideation when they go down those severe paths.
When did you figure out that you weren't just a very hard worker who was successful, but that you're actually engaging in overwork of some kind? Was there a moment or an experience where it sort of hit you in the head?
Yeah. It's about 5 years ago. It was one morning, it's hardly 8 o'clock. And I was totally scrubbed in, hands inside a patient's chest. And I just felt so exhausted. I took the call the night before. I believe that day I was actually on call for the whole month because my co-surgeon, he was off for some of the weeks. We were doing every other week call on the weekend, but I still took calls every night during the weeknight. So I just felt that this is not right. And I started coughing more. And one of the nurses took pity on me and actually passing Dayquil under my mask just to keep me going.
While you're in the middle of a surgery.
Yeah, like you'll be surprised that like plenty of time you'll see us just like step back if you're coughing nonstop and people pop you like a cough drop or something. And then you go right back in, right? And the next morning, of course, was covered with nice sweat, barely got out of bed. I had to convince myself I can't go in for work. And knowing I still have surgery, but what's the point for me to go in when I can't even really stand? When I finally got on a call and asked for a surgical assist to replace me for the day, the answer I got was, Sabrina, you didn't thought to tell us this sooner? Like we can all plan our sick days? Like we don't do this for patients every day that they have emergencies? But nevertheless, I realized all of that is because I continue to say yes to the things and pushing my own boundary until I let the external and my internal expectations to rob my precious time, energy, and sanity.
Yeah, that sounds like me sometimes. Sometimes not. But that idea that you're going to push until your body or some external factor tells you you actually can't push anymore. I'm reminded of times where I've just been pushing hard at work and working silly hours to get some project out the door. There's some launch that needs all this last minute stuff. And then hopefully it's after the launch, finishes, that now is when you get sick, or you realize, wow, I'm not getting out of bed till 10 a.m. because I'm so tired. And wow, after half an hour at my computer, I'm just done. I can't today. I have to do something else. And it's that whole experience of, even if you are mighty in what you can do, that you can push too hard, that exists. And a lot of us entrepreneurs want to feel like, I'm better than that. I can do anything. I can do anything for as long as I need to because I'm better than this experience you're talking about being burned out. But tell us, Sabrina, once you realized that you'd hit that burnout point, how did you go change either your daily life, your mentality, your habits? What did you do to reclaim your passion?
Such a great question. And that's why we're all here. I believe that no matter where you've gone through, we actually don't just burn out. We start losing the aim of what we truly want and become just a zombie going through life over and over again. Because we're so good at what we are doing, we start losing connection to the task, to the work itself, and start losing that future vision. I had to go back to my root of neuroscience and public health, where my thesis and researches were on self-efficacy, self-care, and stress management. And surprisingly, it's actually everything that I'm doing right now. And I realized I need to have someone else look into my life, learning better from more a performance science and positive psychology standpoint on how come there are plenty of entrepreneurs, athletes, leaders who are having us demanding of a life, but they can keep it up. They can keep going, right? They still find joy, satisfaction. But how come so many of us just pushing it, struggling? And so that's when I realized, oh, wow, things can work. We just never learned that way. And so I developed my specific 6-step process. Now I help private practice owners and their team to gain back 10 hours per week while they increase at least 10K per month in revenue.
What is the biggest roadblock that you're finding with healthcare practitioners that is stopping them from the whole being more productive while having less burnout thing?
Number one is that we believe stress is okay. Stress is a normal path of life, instead of stress is not healthy. And if you have stress, it should just trigger yourself to have that alarm inside your head to do something about, but not to just simply accept. And I feel like that's where we all have to start with. Is part of that, when we think about in psychology, is receptivity. Do I receive the knowledge when someone else presented to me or when I notice myself? Do I then take action to do something about it? Or I am refusing to do that because I feel like, oh my gosh, if I'm doing something about it, would I be okay? Would I be successful? Would this lead me to what I need to go? Or the completely opposite, which means people feel like, oh no, I can figure anything out. This is nothing. I'll just deal with myself eventually. And that eventually might never come.
How do you know if you're experiencing too much stress? You talked about cardiothoracic surgeon in surgeries. You can't even go take a Dayquil because your hands are busy keeping someone alive. They're going to die if you screw up. And you're telling us, don't stress out too much, reduce your stress level. But I imagine at the time you didn't wake up and say, I think I'm going to go take too much stress on today.
Right, exactly.
And but you still went and did a high performing job where people's lives are literally in your hands. So how can a lot of us who are not, it's not life and death for a lot of us, how can we properly assess and not be kidding ourselves about what's the right amount of stress to take on?
Yeah, such a great question. It's about what boundary do you actually have for yourself? And I actually have a brief that I created. It's called the 100K month. What that means really is all of us, our month should worth about 100K, right? And it doesn't really matter how big or small you build your practice, you build your business, or you happen to be a leadership in an organization. But the value of how you see your time, how you see your productivity should be there. But what does that really mean to have those value? We have to know what is that that we actually value about, right? Like we care about, that we want, and then not make things complicated. Now, Confucius said, life is simple, then we choose to make it complicated. So how do we simplify that to even identify what is that boundary that we can, let's say, take on that stress, but not go too much further and derail? It's number one, you simply identify 3 value system on a weekly basis, right? What is that 3 major things, non-negotiables? If you get to those things, it will be amazing. It will be great, right? Not make things complicated. So if these 3 major things, any additional demand come to you, you will say, does that match one of my top 3? If it's not, it's automatically elimination. And if it is, then we have to go through a focus funnel to think about, okay, now I want to do this because it's matching what I need, what I'm creating for my vision for this week. Then is it really worth my time to do it now? Because it will produce me time, produce me revenue in the long run. Then, okay, let me schedule and block a time for that. And if it's not, it's maybe will only take me 5 minutes to accomplish it, but every single 5 minute adds up, right? So that means then we have to think about, could I create additional automation system or delegation system to get it off my hand?
The idea of doing the most important things is not a new idea, but you're finding that a lot of healthcare professionals and healthcare business owners aren't doing that, to where they need you to coach them to go focus on the big things and don't do the things that don't fall in line with that. Why is it either that healthcare practice owners or entrepreneurs in general are so bad at following this simple advice?
We all have chaos, and we all allow ourselves to make excuses for having these chaos. Now, the chaos could just be we continue to add on to our to-do list, like how I was before. Right? You feel like, oh, you're high functioning, great. How about you go run this program? How about you fix our team system? How about you arrange some events for bounding for the whole team? Now, we shouldn't be the one who continue just to say yes, feeling like we have to prove our value to other people. We're already valuable. And now we are on a daily basis also have to put out fires, right? Yes, maybe you have things planned out, you know exactly how many patients you're seeing, but all of a sudden, your front desk lady notifies you they have to leave early because their kids got sick. Or some files, the patient intake form should have been done before they got here. They arrive late. They still have to take an extra 20 minutes to fill that out. Now everything starts pushing back for you. Now you start getting more anxious, right? So all these things throughout the day, we can plan everything out, but how do we deal with that? That's a lot of mental fitness training, which requires us to build these things into our life on a daily basis. What we call in positive psychology, these positive quotient, PQ. And research have shown for any one negative thought or experiences takes at least 3 positive ones to replace it. So think about our survival ship, even just our primitive brain. We're constantly being driven to notice things that are bad happening, right? Things don't go right because it's our survival ship trying to help us. However, because we're so easily to notice things are not going right, these negativities, we actually don't have enough positivity to get ourselves out of those situations quickly. And that's what's causing decrease in efficiency and killing our time due to all these additional decision makings and decision fatigue that are happening in our lives.
Well, Sabrina, I know that who you focus on is your healthcare private practice owners. The stories you're telling about, why is it that entrepreneurs make these bad allocation of resources, take on too much stuff? It feels very pertinent to me, and I'm sure many people listening. For folks who are healthcare owners, healthcare company owners, I want to read to you a bit from Sabrina's page from her blueprint because it is so poignant. And again, I think it applies to all of us. So I'm just going to read straight from your website, Sabrina, because it's so beautiful how you phrase this. After overcoming burnout working in surgery, Sabrina Runbeck went back to her roots in neuroscience and public health, helping healthcare practice owners and their teams develop mental immunity. I love that word, mental immunity, so they can do less, achieve higher, and enjoy more. Her clients, and this is where I feel called out, stop having endless to-do lists, constantly putting out fires, or not able to move steadily forward. If you want to gain back 10 hours per week and increase your team's productivity, then you've landed on the right page with the right consultant who is also a recovered clinician. What I love about that, Sabrina, is this constantly putting out fires is such it's a lifestyle. It's like a lifestyle attribute. It's like the clothing we put on in the morning as entrepreneurs is what I'm going to do today is I'm going to see what emergencies there are. And then I'm going to fix all of them while also doing all the work I planned for today, which is already a full day. And I'm going to do it fast with plenty of time left over in the day. And I'm going to do it at a very high quality level. And that mythos is for so many entrepreneurs, that mythos is how they go about their days and their weeks and their years. I'm going to put in too much stuff and solve all the emergencies and have time for my family, for working out, for everything else. So there's this blueprint, folks, where if you want to hear more from Sabrina, you can get this at sabrinarunbeck.com/blueprint. Sabrina, would you please spell your name for folks?
Yeah, it's Sabrina, last name Runbeck, Runbeck.
And then that's .com/blueprint. Sabrina, where can folks connect with you on social?
I'm very active on LinkedIn, so please find me there. Love to have a conversation. You'll find me sending you voice messages because I hate texting.
Love it. I love it. Well, Sabrina, thank you for being on Beard Radio, and thank you for helping us think about why it is that we keep on taking on too much.